Thank you. Mr. Speaker, it's going to be a little difficult for me to talk about this because it's such a serious thing and it affects my own life. But I'm going to give my best shot. I developed this bill because last November I witnessed on the local news a mom, Millie Coombs. She brought her daughter, Nikki, to the hospital, who has severe disabilities and is nonverbal. And because of COVID, she was told that she could not stay with her child. Her child is an adult child, 36 years old, and for 36 years, her husband never left the side of the child anytime they went to the hospital, which was hundreds of times. I can relate to this because I've gone through the same thing. In the first 2 years of my son's life, he had 18 operations. And no matter what, I never left his side. The reason I never left his side is because he can't communicate. Because you could see the fear in his eyes if somebody wasn't there just to hold his hand. He needed to feel that love. He needed to feel safe. I cannot imagine what this woman went through, all because of COVID. And as I've told this body in the past, Mr. Speaker, it's not COVID that's the culprit. It's how we're dealing with COVID. This is the year 2020 and 2021. By now, we should know how to deal with COVID, and we should be able to handle this situation. Millie's daughter, just like my daughter, my son, she was scared. She was frightened. She can't hit the call button. She can't tell anybody if she's in pain. She can't tell anybody anything. And the doctors and the nurses have to guess. Why should they have to guess? Why should a child of any age have to sit in a hospital by themselves in fear? Why? Mr. Speaker, and I said this before and I'll say it again, this is common sense. If a nurse or a doctor can be in the room safely, then they can prepare a parent in an extreme condition like this to be safe with their child. The hospitals justified their action because they feel that it's a safety issue and that they must follow certain unsubstantiated safety protocols set by Medicare, etc., which is not true. Remember, Mr. Speaker, that the CDC said that 99.986% of anyone under 70, unless they have a condition, have only had mild to moderate reactions to the COVID virus. So why would we stop a parent from being with these little children? Why? I cannot send my child to the hospital right now. No matter what happens, he's not going to the hospital. The hospital is going to have to come to my house because my house is safe. My house, you don't have to worry about all these extreme measures. My kid's not going to the hospital because I'm not going to leave him there. Because what's going to happen is if you try to do something to my son and he doesn't think he's safe, he's going to do what's normal. He's going to fight you because he doesn't know what you're doing or why you're doing it to him. And they're going to have to restrain my son. There is no way, Mr. Speaker, that somebody is going to restrain my son. when there's no need for it. My son is the sweetest, kindest little boy you'll ever meet. To have him restrained because they won't let me in the hospital? This is beyond understanding. Imagine, okay, the good representative, I think from Reedfield. If I'm wrong, I apologize. He said there's nothing worse than seeing your child seriously hurt. Mr. Speaker, I'd like to correct the gentleman. There is one thing worse. And that's seeing your son or child seriously hurt, brought to the hospital, and then you got to leave him there. You have to abandon him. You have to look into their eyes and see the fear in their eyes as you walk away, abandoning your child. Because in the year 2021, doctors and nurses can't follow safety protocols and have you be in the room? I don't get it. My good friend the representative from Portland said he took an oath to prevent pain. I would like somebody here to tell me what greater pain is there than the pain of the heart when you're leaving your precious gem of a child in a hospital by themselves. It's inhuman. Mr. Speaker, the ADA and several other organizations, including hospitals, have testified that there are protocols in place. That's true. There are protocols in place. Millie Coombs tried them all. The ADA failed. She was still not able to see her child. They provided her with an attorney. The attorney talked to the hospital. That's it. Done. The hospital says, we have protocols. Millie Coombs still couldn't see her child. So, are there really protocols in place, Mr. Speaker? The answer is no. Because if they fail over and over and over again, those aren't protocols. And lastly, Mr. Speaker, well, two things. No, just one. Mr. Speaker, this bill is a test. Jesus is watching. And this bill is a test to see who exactly has love in their hearts. Thank you, Mr. Speaker.
Chair would remind the member to not question the motives of other members of this body. Chair recognizes the representative from Penobscot.